The North's public transport system often fails the residents and communities who need it most. In our new research report, we found that more than 40% of the carers, disabled residents and low-income residents that we surveyed are facing social exclusion, specifically because of issues with the transport system. And with the rising cost of living, we see people's everyday transport spending pushing them into severe financial hardship and into poverty. For example, more than 1 in 4 of our respondents said that the money they spend on getting around makes it difficult for them to afford other essentials like their utility bills or their food shop, and that's clearly unacceptable. Underlying that, the North has been hit by large and wide-ranging cuts to bus services. The 5 areas we studied have seen cuts ranging from 11% to 52% between 2010 and 2023, with many services running less frequently for less of the day, or in some cases no longer running at all. And part of what we do in this report is look in detail about how this affects access to healthcare, which was a key concern from many of the residents that we surveyed. And we find that many residents face bus journeys of more than an hour each way to reach their nearest NHS hospital. And that's often more than double the time it takes to do the same journey by car or by taxi, which pushes residents towards more expensive transport options. And because of this combination of cuts to bus services and the rising cost of living, we find that social exclusion issues are widespread, even in areas where the risk was relatively low back in 2019. Cuts to bus services, the rising cost of living, and some of the legacies of the COVID-19 pandemic have combined to make this an even more urgent challenge than it had been 5 years ago. The report is available to download from Transport for the North's website, where you can see much more on the areas that we studied and some of the everyday challenges that many residents face because of transport issues.